is Dr. Rachel Vreeman. I am the chair of the Department of Global Health at the Icahn School of Medicine at Mount Sinai in New York. I am also a pediatrician, and I specialize in taking care of children with infectious diseases like HIV, TB, and malaria. And I'm here to really talk about what it looks like to protect children in Guyana from infectious diseases. I have also written 3 books about medical myths, talking about the ways in which we sometimes believe half-truths or outright lies about things that might make us sick or things that might make us healthy. So I wanted to talk about a few of those medical myths today. When we hear about COVID and we think about COVID in kids, there are some really big myths that come out. The biggest one is that kids don't get COVID, or kids don't need to worry about COVID. Kids don't need COVID vaccines. Those are myths. Now, it's true that kids are often not as severely impacted by COVID, and as pediatricians, we're really grateful for that. But kids can absolutely still get very sick with COVID. We have kids, even in the United States, who are hospitalized, who have died from COVID, or who have the complications of long COVID, things like long-term problems with their breathing, with strength, and even with their immunity to other infections going forward. We want to prevent things like that from happening to your child. And the way to do that is by having them get a COVID vaccine. Now, another myth that people hear is that these COVID vaccines are not safe, or you may particularly worry that they're not safe for young children. This is absolutely a myth. These vaccines are safe. They have been tested over and over and shown to be safe. And the technology that they're based on is actually technology that's been in place for a long time. We know these vaccines came about quickly, but that doesn't mean they're not safe. And we've continued to test them and look at that technology, and they've done really, really well. Perhaps the best example I can give is actually my decision related to my own child. I have one child. He is the most precious thing in my life, and he turned 5 years old in this year, in 2022. And I immediately got him vaccinated. I let him have his birthday, and the day after his birthday, he got his first vaccine for COVID. He's since got his second vaccine to complete the series, and then a booster to make sure that he had absolutely the best immunity possible. We can protect children from this virus. We can protect other people in your family, especially older people or people who might be more at risk of getting sick, by vaccinating everybody, and we really want to do that. I would encourage you to make the same decision that I, as a pediatrician and as a researcher, made for my own child. Get all children who are 5 years and older vaccinated. Another concern that you may have heard is that the vaccines that are available in Guyana are not the same as the vaccines elsewhere, maybe that they're not as good or that they're not as safe. This is absolutely a myth as well. The vaccines that are here in Guyana are the very same vaccines that we have available in the United States and in other parts of the world. They've been tested in the same ways, found to be safe in the same ways. They're the very same vaccines that I gave to my child, and that people are getting in other places around the world as well. These vaccines are tested and are safe. Another myth is the idea that COVID vaccines might actually cause you to get COVID, or that people who are vaccinated with a COVID vaccine could then pass COVID from that vaccine on to someone else. This is a myth we hear about the flu shot as well. People worry that the flu shot is actually going to give them the flu. These are myths. These vaccines do not contain live virus. They do not contain virus that can be reactivated to actually make you sick with this virus. They contain either dead virus or a tiny piece of the genetic material of that virus. A dead virus cannot be resurrected to make you sick. It just doesn't happen. In the same way, you can't pass on that infection from the virus to anyone else because it's not a live virus that can be passed on. Now, It is true that you might feel sick, you might have some side effects after you get the virus. That's true. That doesn't mean that the vaccine itself is making you sick. Those are side effects to the vaccine. In fact, those side effects, whether you have a little bit of a fever, you feel achy, you have a headache, those side effects show that your immune system is working. They're actually a great sign, even though none of us want to feel that way. They're a great sign that your body is mounting up its response to be absolutely as ready as it can be to fight off that infection if it sees it. Another myth we hear is that people worry that these vaccines don't work that well. After all, we keep saying you have to get another and a booster, or maybe you've heard about somebody who got the vaccine but then still got sick. This does not mean that the vaccines are not working. First of all, the vaccine cannot prevent the virus from coming into your mouth or coming into your nose. That's something that only masks can do. What the vaccine does do is prevent that virus that you might be exposed to from making you more sick or causing the kind of severe complications that can lead to death or that could make your child really sick and in the hospital. The vaccine is still absolutely working. It just can't prevent that first step, and it does what it needs to protect you. The reason that we have you come back for more vaccines, that we say we need boosters, is the exact same reason that when children are babies, we give them one set of shots after another after another. This is how your immune system is best prepared to fight viruses. Sure, having just one shot does probably give you some protection, but your immune system is going to be able to do even better at fighting those viruses if it's seen that virus material in the vaccine again and again and again. Each time your immune system gets stronger, it makes more of the soldier cells that can attack that virus when it comes into your body for real, and it prepares you to be able to even fight off new variants as we better match the vaccine and the virus to the ways that the virus might change over time. Another concern some people have, or that I've heard people say, is that, oh, you doctors make money off of these vaccines, or you just want us to get this vaccine as a way to make more money. I am in no way supported by any of the companies that make these viruses. I don't make any money off of you getting a vaccine, and that's true for doctors across Guyana as well. What doctors care about is keeping you healthy. And the best way to keep you healthy, in fact, to keep you out of our clinics, to keep you out of our hospitals, is by protecting yourself and protecting your children with these vaccines. So as a pediatrician and a health services researcher, it's been my great privilege to be able to collaborate with the Ministry of Health in Guyana around what it would look like to strengthen your health system and to help Guyana achieve a health system that protects and serves all children and all families in Guyana. I'm so honored to be able to talk as part of this ongoing long-term partnership between the School of Medicine at Mount Sinai in New York and the Ministry of Health in Guyana today.